Hello, everybody, and welcome. I'm Alannah Woodrow, a pelvic pain and invisible illnesses dietitian and founder of Thrive As You Dietetics. Welcome to today's presentation, Systems Approach to Thrive As You. Just a little disclaimer, this presentation does not replace treatment provided by medical and allied health professionals. The treatment of endometriosis responds best to multidisciplinary care. Please consult with your medical professional before commencing with any of the information provided today. Okay, so a little bit about me. I'm, of course, a dietitian, a Brisbane woman, an avid foodie. Definitely, I love my coffee and treats. A lover of sunset, a business owner of Thrive As You Dietetics, and I'm also a spoonie. So I have lived experience of endometriosis and persistent pelvic pain amongst a few other conditions and neurotypes. So I definitely have that lived experience perspective as well. I offer one-on-one dietitian consultations through Thrive As You Dietetics, and we provide tailored nutrition to your overlap of pelvic pain, neurodivergence, and connective tissue disorders. My top tips and strategies I will share with you today are nervous system related, gastrointestinal system related, and Thrive As You related. Now, firstly, I really wanted to acknowledge the whole body disease that is endometriosis and pelvic pain. So this affects 7 different systems of the body, from your nervous system, psychological system, immune system, hormonal system, and gastrointestinal system. And this requires person-centered care as well as a whole person approach. It's best to have interdisciplinary care approach, so multiple different healthcare practitioners working together with you. And I really wanted to highlight Thrive As You Dietetics, also known as TADE, our values, which are here next. So we are evidence-based, strengths-based, neurodiversity affirming, trauma-informed, and empathetic. And these values have really been born from my lived experience and how important these values are to people living with pelvic pain and invisible illnesses. And I really want to help you advocate for this kind of care for yourself, whether that is with Thrive As You Dietetics or from any other practitioner, medical or allied health. I really want you to have these values in your front of mind when you're trying to select your team members. Our first top tip, nervous system related, is looking at the regular eating rhythm. So this starts off with feeling hunger from our energy and hunger hormones that are signaling. You then move on to mobilize to get a balanced meal. And this is what you should include in a balanced meal: carbohydrates, healthy fats, protein, 3 colors of vegetables or fruit, and fiber. And then you're eating that and you're moving on to feeling satisfied and full, and you're going to be staying within your window of tolerance. And from that, you're going to be then having balanced and stable blood sugar levels. Now, having a look at the irregular eating rhythm. So we're going to be having low blood sugar from long periods of not eating, and the body senses this as a danger. This is a danger signal. And from that, adrenaline hormones rise in the blood, and this activates the fight or flight response. This response means that blood flow is restricted from the gastrointestinal tract or your gut, and it is directed to the muscles to help you fight or flight, which means that you can be experiencing more bloating, irregular bowels, possible nausea, low energy levels, and reduced resilience to pain. And this is all really important to be making sure, firstly, the top tip here is regular eating. We don't want to be in this irregular eating rhythm because we're going to be having more symptoms, okay? So remembering how you do get to have regular eating is focusing on this balanced meal here and including these components to make sure that you're staying out of this irregular eating rhythm. Now, I have a couple of quotes here that is really focused around supporting your nervous system, and they are inspired from some books, which I will share soon. So choose to listen to your body. Let your body tell you the story it wants to. When you approach your body with curiosity rather than fear and feel safe in your body, everything shifts. So really remembering these quotes can be really helpful to support your nervous system. We really are wanting this down regulation. When we're talking about persistent pelvic pain, this is pain that has changed the way your nervous system works, okay? So it's upregulated and increased your nerve signals of pain to your brain. And this is often termed visceral hypersensitivity. So really having these quotes at the forefront of your mind will be really helpful in improving your nervous system. Now, moving on to the second top tip, gastrointestinal system related. I like to call this our sweet gut spot. So what we're wanting is regular pain-free bowel movements that are every second day to maximum 3 times a day. We're having gas production and passage of wind, which are all natural signs of gut functions. We're having occasional bloating, which is a natural sign of fermentation in the bowel. So this is totally normal, and this is different to endobelly. And I want to make that distinction clear that occasional bloating is natural and normal signs of fermentation in the gut, but endobelly is often that quite painful, tense pelvic pain. As well as we're wanting complete evacuation of our bowel motions. So we're wanting to feel like we've fully emptied our bowels when we've opened. And then lastly, so some changes to bowel motions around menstruation are quite common and normal. And they're often quite pronounced in people with endometriosis, and this is due to the prostaglandin hormones acting on the gut as well as the reproductive system, so your uterus. And we are also aiming for types 3 and 4 stool quality on the Bristol stool chart here. And now, so a 2015 study that assessed gastrointestinal symptoms with endometriosis patients within the last 12 months found 85% had total gut complaints, 65% of this was constipation, 50% IBS, 41% nausea, 43% diarrhea. And this is the link here to this study. Now, I am not really going to be focusing too much strategy-wise around constipation and diarrhea because the Toolbox Essentials and Nourish to Thrive sessions include some things on fibre and fluid management. So have a look there for some tips on that. Now, I wanted to focus on IBS because 50% of patients from this study with endometriosis experience IBS. Now, some strategies that I use here at Thrive as You Dietetics is navigating food fears for a sweeter relationship with food. Often when we're experiencing IBS, it can be really, really easy to start restricting the food that you've just eaten or the drinks that you've just had, such as coffee or high FODMAPs, things like that. And I really want to take a step back and help you navigate your food fears for a sweeter relationship with food to help improve your IBS. So IBS is a very hot topic. There's a lot of information freely available, which is not always evidence-based or strengths-based or tailored to you. Now, I'm not focusing on constipation or diarrhea here because I think in the other sessions in the Managed Endo program, we'll have a little bit about fiber and fluid management. So go and have a look at those for some strategies on that. Now, I am trying to support you to navigate your food fears for a sweeter relationship with food and improved IBS. When we experience IBS, it can be really easy to start restricting food and the drinks that we've had as triggers for the IBS. I want us to take a step back together and look at navigating your food fears together. And I use the Revive model to do this. So we will go through nutrition foundations before we do an elimination step. And that's really, really important because this population where we are experiencing pelvic pain, as well as other invisible illnesses, whether you have neurodivergence or connective tissue disorders, as well as endometriosis and pelvic pain, we want to be making sure that you're safe when you're doing your elimination. We want to making sure that if you are at risk of an eating disorder or disordered eating, that you are being supported by a qualified, accredited practicing dietitian to do this elimination of food safely, to be really making sure that we are identifying triggers in a safe way for you. Now, in the Revive model, some strategies that some of the foundations that we would go through is regular eating mindfully, modifying fiber intake and irritant load or triggers, and prescribing probiotics. And we're going to be doing that before the elimination step. And if we go through all of those steps and you deem that you're still having triggers, you haven't improved your IBS, we will then discuss an elimination diet if it is safe to do so for you. Some other strategies can be fermented foods for gut health to help improve your gut microbiome, as well as mental health via healthy fat. So things with like your omega-3s, which is also included in another session. So have a look at those as well. And moving on to some strategies for nausea. So making sure you're eating and drinking small amounts, often cold food is better tolerated than the hot food and the smell of hot food. Focusing on carbohydrate-rich, low-fat or light, high-protein snacks is really important. And ginger can also be a helpful supplement to include, or if you like ginger flavors, adding ginger root into your cooking and meals. All right, and lastly, moving on to the Thrive As You related section for today, and the top tips and things that I would like to share to help you thrive as you. And this is something that I really wanted to include as a lived experience practitioner as well as a dietitian. So how can we best support you, your endometriosis, your pelvic pain and your flares? Because let's be honest, when we're having a flare, nutrition can go out the window. And this is more than okay. This is what happens. This is what it's like to live with endometriosis, right? So firstly, I want you to eat what you feel like eating when you're in a flare. When you're in pain, it's nasty, okay? So be kind to yourself, make sure that you're listening to your body. And we're going back to that nervous system stuff that we've already talked about. You're listening to your body, you're listening to what it's telling you, and you're listening to your appetite, your hunger signals, and all of that. Find some loose clothing that you like. Reduce that pressure on your pelvic area and your abdominal area. And if you feel your flares in your lower back, reducing that loose clothing and tightness around your back as well. Having peppermint tea on tap, that's something that can really help reduce some bloating, some gastrointestinal symptoms that you're feeling if that is involved for you with your flares. Applying heat packs, applying TENS machines, breathing tools, if you've been taught some of those from physios or psychologists or other members of your healthcare team. So diaphragmatic breathing can really help when you're having a flare of pain. An aesthetic physical toolbox to store all of your tools to use when you're in a flare. Something that's visually appealing, that's nice to look at, right up your alley, that helps you thrive as you. A toolbox that's easily accessible for you and anyone else, like your MVP who helps you out when you're in a flare, that's easy for them to grab and help you. As well as pill boxes for medications. And this is making sure that you have your medications available, easily labeled, and making sure that they're nice and little and compact, and they can go in your handbag or your purse. They can go in your car with you. So you're going to be having medications and that support with you all the time. And most importantly, with flare management is making sure that you're not overflowing your bucket. So at any given day that you're assessing what you've got on your plate or in your bucket, and making sure, so if you're a spoonie and you identify as a spoonie, you can wake up, see how much spoons you've got in for the day, and assess whether you need to take some things out of your bucket for that day if you're lower on spoons. And vice versa for days where you're feeling great and you've got lots of spoons. You need to be making sure that you're not overflowing your bucket. As well as using pacing strategies. So remember to pace yourself throughout the day, the week, the month, and making sure that you're supporting your bucket the best that you can. And some self-care tips. So you do matter. Some tips that I've got for you is some journaling, creating routines to help support sleep. So often this involves having dinner, some warmth, and this can be tea or shower. Research suggests that that can help bring on those sleeping hormones. The rest, if you do some gentle stretching before bed, you can do some of that, and low lights, especially for anyone that is a bit neurosparkly, that can also really help with setting up a good routine to help support your sleep. Do what brings you joy. Find your hobbies, find physical activity that brings you joy. If you like reading, painting, anything that you like. Life is really hard living with endometriosis and persistent pelvic pain. So any time that you can find those glimmers in your life, whether they're short-term glimmers, long-term glimmers, and joy, it's really important to do that for yourself. And making sure that you have a wonderful support system around you. So whether that is joining the Qendo mentor program or attending support groups in your local area run by Qendo, or other pelvic pain support groups. Sometimes physios and psychologists run some support groups. So get in touch with your team member to see if they have any support groups that they can recommend. As well as find your comfort place. So when you're feeling low in energy, whether you're fatigued, you've got some brain fog going on, or you're in a flare of pain, finding your place of comfort, whether that's in bed or whether that's on the couch, lying down, curled up with a heat pack, a TENS machine, whatever tool it may be. Find your comfy clothes, whether that's an oversized t-shirt or loose track pants or something like that, a blanket, and find your comfort shows or movies as well that all promote you to rest. And most importantly, listen to your body with this. So going back to that nervous system stuff that we've talked about, listening to the story that your body is telling you at any given moment. Now, I really wanted to touch on some books that I have read personally and that I would recommend. So the first one here, Endometriosis and Pelvic Pain by Dr. Susan Evans. This is the one I wish I had read before I started my diagnosis and treatment journey for endometriosis. It does include some great information on the condition as well as some evidence-based diet and nutrition strategies as well. Moving on to the second one, the one I needed to read to help heal my soul a little bit from my pelvic pain. Now, this is Healing Pelvic Pain by Dr. Peter Wright, a gynecologist. This one does come with a trigger warning for trauma and sexual trauma, but this one is a really soul healing book. She's wonderful at writing, so definitely check that one out. Moving on to the third recommendation, How to Endo by Bridget Hastwaite. The one I needed to read to have an endo sister with me. So she's done a wonderful book here of a guide to thriving and surviving with endometriosis. Moving on to this one here by Marie Davenport, The Australian Guide to Living Well with Endometriosis. This one is on my to-do to read. This is a new kid on the block. It was released in February this year in 2025. So I'm yet to read that one, but I'm sure it will be a good read. Some other books that I would recommend reading if you're in the overlap that I focus on with pelvic pain, neurodivergence, and connective tissue disorders. If you are neurodivergent yourself, I would recommend reading the Dr. Devon Price Unmasking Autism. This one is for the neurodivergence in you. And moving on to The Body Keeps the Score. This book does come with a trigger warning for trauma and sexual trauma. This is the one every human needs to read, I believe, all about healing trauma. I also do purchase all of my books from Amazon that I have recommended here reading. And then some other books here that are on my to-do list to read. So A Headache in the Pelvis, Come As You Are, When Sex Hurts, Better Sex Through Mindfulness, Healing Through the Vagus Nerve. And I do have a note here that I would recommend asking anyone in your healthcare team if they recommend any books for you to read. I think there's lots available, and they're quite an easy read. So they are providing you with evidence-based information. A lot of these books are written by doctors and gynecologists or other healthcare professionals, and they're quite, they break it they break all the medical jargon and the health language down for you. So I really recommend having a read of these if you are a reader. Alrighties. Now, thank you so much to Quendo and the team for inviting me to present with them today. I really hope that these top tips and strategies that I've shared help you. And if you are interested in working with me and Thrive as You Dietetics, this is how you can do so. So I've got all of our contact details. We are a Brisbane-based clinic, so we do offer telehealth services and maybe, hopefully, a face-to-face location coming soon. And also a QR code that you can scan if you would like to book in now. And as I mentioned previously, briefly, I do focus on the overlap of pelvic pain, neurodivergence, and connective tissue disorders. So whether you are experiencing autism, ADHD, any other neurotype, or you live with hypermobility, Ehlers-Danlos syndrome, POTS, anything in the connective tissue realm, I'd be more than happy to be your dietitian. And I do see patients for any of these areas, whether you're only experiencing pelvic pain or only connective tissue disorders, or you've got that lovely little overlap.